Welcome back to Good Morning Sri Lanka with me, Jason. Today we're speaking about health and lifestyle, and we have Dr. K.D. Dominda in the studio, speaking about, he's a consultant physician, speaking about what you can do to have a better lifestyle, healthy lifestyle I should say, a better life.
Yeah.
That's simple, right? If you just put it, have a better life if you eat healthy, if you work out. Now, before we went into break, you were speaking about vegetables, the importance of vegetables, because I know I'm one person that hates my greens. I do not like my vegetables at all, except for tomato. That's a good one. But let me know what the other vegetables and why is vegetables good for you?
Because you can replace the amount of carbohydrate you take with vegetables.
Really?
Yes. So nowadays we talk about not rice and curry, but curry and rice.
That is correct.
Right. This vegetable stuff gives you a lot of fiber and a lot of vitamins, and also some minerals and other antioxidants. So nowadays we are eating more vegetables than starch.
Alright, now you mentioned, this is very similar to what I mentioned before as well, less curry, more rice. Now I've noticed that a lot of Sri Lankans, not noticed, this has been happening for a long time, Sri Lankans, Americans, anyone around the world, an unhealthy lifestyle just stems up when you're stressed out, when you're working. What is the worst case that you've seen in your experience in Sri Lanka so far?
Yeah, I mean, they are eating the 3 large big meals, which has lots of carbohydrates. As I told, carbohydrate should give you 50% of your energy requirement. Probably some people take about 70-80% of energy through that. And we were talking about the calorie intake. So the carbohydrate will give you 50% of calories. So suppose your daily calorie requirement is 1,800.
Right.
But some people take 2,500, 3,000 calories out of carbohydrate.
Right.
That will definitely add on to the complications.
Right.
You keep on putting weight. You end up with high blood pressure, diabetes, hypercholesterolemia, high lipids levels in your body.
Okay.
So which is bad. So having a healthy lifestyle, including diet, exercise and your mind, is very important before you get all these bad non-communicable diseases.
Right. Apart from diseases, you also tend to gain a bit of weight, and I believe that we have a few slides on the different body shapes of how you would outgrow yourself.
Yeah.
There's a pear shape and an apple shape, if I'm correct.
That's right. Yeah. This, the bad thing about this weight gaining is that...
there it is.
Yes.
The apple versus the pear.
Yes. When you keep on eating a lot of carbohydrates, fats, and forget about your vegetables and fruits, you tend to accumulate fat more inside your tummy.
Right.
Deep in the tissues.
So
around
this is the pear shape we're talking about.
Not only in the skin, but in the deep in your tissues, like around your organs, liver, and inside your tummy. So that will give rise to the shape of a apple.
Okay.
But if you are having a good diet, good exercise, your body will be like pear.
A pear.
You may be putting a little bit of fat around your hips and thighs, not in the tummy and in deep tissues.
The pear shape I would suggest for women, but if it's a man, you turn the pear the upside down and it's more broader, slimmer.
It is not healthy.
It's not healthy at all, is it? Okay, one thing that I've noticed, a lot of our boys here in Sri Lanka, or men that work out, they tend to only work on their upper body. And then when you look at their feet, it's very slim. So again, why is this because of the way they eat? I mean, it's obviously one, because they work out only on their upper body, but is it a bad thing that if you only work on your upper body, that the good nutrients or whatever you need to function would not go to your feet? What do you think about that?
Yeah, if you are having good exercise program, it shouldn't happen. You know, people who are willing for the bodybuilding, those are type of the aerobic exercises they do. You keep your muscles in a tonic phase, which is not very healthy, and it won't give rise to much health benefits long term. What is important is to do some aerobic exercises. The main aerobic exercise accepted in the medical field are walking or running, jogging, and then cycling, swimming. Those are the aerobic exercises.
Right. So you're saying
Those are
cardio
more
is
healthy.
very important.
Yes.
Cardio before you start gymming or whatever is important. That is your base plate of having a
Yeah.
very healthy lifestyle. That makes sense. All right. Now a lot of people here again, they would go to a doctor without the adequate knowledge that a doctor has the right pizzazz to give the right diagnosis. How would you advise a regular person at home to go about this? How would they research on how a doctor do this, or how would what would your advice be on that?
Advice on?
On finding the right doctor.
That's a difficult question to ask. Of course, in the medical field there are so many specialties and subspecialties. Best thing is to have your personal doctor,
Right.
Probably GP.
How do you find one though? Like, how would you know that, you know what, this doctor knows what I need? How would you tend to?
I mean, it's a personal rapport between the doctor and the patient. You have to develop it gradually.
Right.
You cannot find your right doctor overnight unless you are referred to a specialist doctor for a particular purpose. The GP is the best person to go and see. He knows your family.
Right.
And he knows your illness for a long time, and he can be the best referrology doctor to meet your specialist.
Right.
What has happened nowadays is for simple illnesses they go to the specialist,
Right.
and which is not really necessary.
Right. Would you suggest though that like if I'm a person looking for my own personal doctor, I'm not really sure if this doctor knows exactly what I am about, what my body is like. He should know it, but would you suggest that I Google try and find out as much information about my unwell being, like if I have a flu or whatnot, and then I go and talk to the doctor? Would that be right, to actually know what your body functions are all about, and then you go and talk to this doctor? Would you suggest that would be the ideal way to go about it?
No, at least having good consultation with a good doctor before you fall in sick is important. I won't say no. So when you go to the doctor, you have to be specific about what you are going to ask the doctor,
Right.
and have a very fruitful conversation with whoever the doctor who is there. Then the doctor will decide which field you need to be referred to.
Okay.
So that's the answer I could give.
Okay.
Offhand.
Tell me about your patients. Obviously anonymous. We're not going to name any patients. What has been the most extreme cases that you've seen from anything, ranging from a regular cold, flu to something like excessive heart rate or something to do with their heart?
In day-to-day life, regularly what we see is difficult cases are, the heart attacks, strokes. They are miserable.
Yeah.
Especially the strokes. When it comes to strokes, they leave you with some disability. So these are non-communicable diseases. In fact, these diseases we should be able to prevent with right advisors, right treatment before they develop the complications.
Right.
And also the cancers. When you see a cancer, it's very pathetic.
Right.
So before a person develops cancer, we should rather detect them, or even before that we can prevent them. There are ways and means of preventing. We have the knowledge, know how to address these issues.
Right.
It has become, in fact, now a national issue, these non-communicable diseases. The Ministry of Health is working hard on that.
One quick question. Is it true that cancer, that a regular person, you, me, everyone here in the studio, that we fight cancer every day? Is that true?
Yeah, that's true, because there are cancer cells produced in your body without your knowledge. But there's a self-defensive mechanism, immune system, they kill before they form.
Right.
That's maybe the thinking, which is right.
Okay. So again, this is your, if you allow me to go into your mind, this is your subconscious mind controlling your body, if I am correct. Your subconscious mind tells your immune system, look, there's a cancer cell, destroy it. If you use that same principle onto a patient that actually has severe cancer, could that work? Like if this person learns, you know what, I'm going to be positive about this, I'm going to be a very spiritual person, I'm going to believe that this cancer is not in me anymore. Can that work?
It is important for a person to not to get shocked when you are having the bad news.
Right.
So there may be a role in your subconscious level,
Yeah.
in helping you to recover soon.
Right.
Because we have seen a lot of people, we treat them, we cure them, they go home, still they come back, bounce back to us
Yeah.
with a lot of complaints.
Right.
That may be the subconscious mind that may be playing that I am not cured, I am not treated well. So it is important for you to understand the illness, but not to get panic or shocked about it, but to seek the right medication and believe your doctor and the medication and get cured.